Today I'm going to be doing a bag change and showing you the different pieces for the SmartBag system. So I always have to get my shirt kind of out of the way, so I use a hair tie, and then I don't use any adhesive remover. I just kind of loosen the tape around my bag and just peel it off nice and slow so I don't irritate my skin. Adhesive remover does come in sprays and wipes, so you have options. And then I actually use my old bag to wipe extra stuff away. And I don't use any special soap or anything. I just use scraps of toilet paper because that seems to work fine for me. And sometimes soaps can leave residue on your skin that makes it a little bit harder for your bag to stay stuck on. While I'm waiting for the skin to dry and air out a little bit, I like to use a Dixie cup just as a precaution because sometimes my stoma is a little bit rebellious and thinks that bag change time is an acceptable time to spray everywhere. While the skin around my stoma is drying off a little, because sometimes I get some irritation and bleeding, I'm going to cut my stoma size in the wafer. That's something you can do ahead of time if you want. I just tend to use the time that I'm using for my skin to dry to cut it. There are special ostomy scissors that are curved, and sometimes those will come in like packs of 3 or whatever. You can get those off the internet. And I have slim barrier rings, so you can see it's very thin, and that makes it not puff up too bad. And there's like a tiny drop of something right here. But other than that, my skin is nice and dry. So now I can put my barrier ring on. So I just kind of want to stretch this out slightly, see how it's kind of flexible. At its smallest, it's a little bit too small. So I just kind of gently stretch in all directions. And then when I press it on, I kind of keep my fingers there for a minute, but I move them around slightly because, as I have discovered the hard way, sometimes the barrier ring will stick to your fingers when you're putting it on, and that's not really ideal. So here's the smart wafer, and you can see there's electronics here, and then the back just kind of peels off. I'm using my mirror to keep things kind of centered. There we go. So this gets just kind of stuck on gently, and you can kind of press around just a little bit in the circle to make sure everything is adhered right. Here's the SmartBag. This presses around like Tupperware. So what you want to do, just to make sure that it's all tightly sealed, once you press it on, is really feel all the way around, because sometimes you'll feel a slight pop when the rest of it comes together, and that's what you want. And I should note, I have closed the bag, the end of the bag ahead of time, because that's a mistake I used to make. I used to not close the bag right away, and sometimes I'd like walk around the house for a minute and I'd forget. So I also have the tail tucked in and Velcroed here. And then I have the hub all nice and charged. I charged it overnight, so it's all set to go right now. So I just tuck that in the pocket here, tuck the bag in. Ta-da! I was so excited to be able to try the SmartBag out because I feel like it's a really important step forward in ostomy technology. They might as well be tech wizards at 11 Health. I don't know how any of this works, but I'm so excited to try it and see how it's able to improve the lives of patients. A lot of people have questions about what you can wear with ostomy bags, and I've even worn my SmartBag with leggings, so I don't think it's a huge thing to have to worry about. Like, you don't have to live in sweatpants if you don't want to, but absolutely do wear sweatpants if you want. As you can see, today I'm wearing very comfortable pants. So wear what you like, and I hope you enjoy trying the SmartBag out.